Your blood pressure reading came back at 150/95. The silent killer, they call it. And right now, as you're watching this video, hypertension could be quietly damaging your heart, your kidneys, your brain, without a single warning sign. But here's what your doctor might not have told you. You have more control over this than you think. And today, I'm going to show you exactly how to take that control back, starting right now. And I've seen firsthand how high blood pressure can steal away the golden years you've worked so hard to enjoy. But I've also witnessed something remarkable. Patients who've brought their numbers down naturally, reduced their medications, and reclaimed their energy and peace of mind. Today, we're talking about hypertension, high blood pressure, and most importantly, what you can do about it without relying solely on medications. This isn't about quick fixes or miracle cures. This is about proven, practical strategies that work with your body, not against it. Section 1. Understanding the problem. Let me be direct with you. High blood pressure affects nearly 2 out of every 3 adults over 60. That means if you're watching this video, there's a very good chance either you or someone you love is dealing with this right now. What exactly is high blood pressure? Think of your blood vessels like garden hoses. When the pressure inside those hoses gets too high, day after day, year after year, something has to give. The vessels can weaken, tear, or become damaged. Your heart has to work harder, pumping against that resistance. Over time, this leads to heart attacks, strokes, kidney failure, and even dementia. Normal blood pressure is below 120/80. When your numbers consistently rise above 130/80, you're in hypertension territory. And here's the frightening part. You can feel absolutely fine while this damage is happening. No chest pain, no shortness of breath, nothing, until suddenly everything changes in an instant. But why does this happen as we age? As we get older, our blood vessels naturally become stiffer, less elastic. Our kidneys don't regulate salt and fluid as efficiently. Our bodies become more sensitive to stress hormones, and often, decades of dietary habits, stress, and lifestyle choices catch up with us all at once. The good news? The very good news? Your body responds beautifully to the right changes, even after years of high blood pressure. Section 2. Natural ways to lower blood pressure. Now let me be crystal clear about something. If you're on blood pressure medication, do not stop taking it without talking to your doctor. What I'm sharing with you today works alongside your treatment and in many cases can help you reduce medication over time, always under medical supervision. Movement and physical activity. Your heart is a muscle, and like any muscle, it gets stronger with exercise. But I'm not talking about running marathons or pumping iron at the gym. For seniors, the magic happens with consistent, moderate activity. Just 30 minutes of walking, 5 days a week, can lower your blood pressure by 5 to 8 points. That's as effective as some medications, and it doesn't have to be all at once. 3 10-minute walks throughout the day work just as well. Swimming, water aerobics, gentle yoga, tai chi, even gardening, these all count. The key is finding something you enjoy, because you're much more likely to stick with it. And consistency is everything. If you haven't exercised in years, start slowly. 5 minutes a day, then 10. Your body will tell you when it's ready for more. Listen to it. Weight management. I know this is a sensitive topic, but let me share something important. For every pound you lose, your blood pressure can drop by about 1 point. If you're carrying extra weight, losing just 5 to 10 pounds can make a significant difference. But this isn't about crash diets or deprivation. It's about making sustainable changes, smaller portions, more vegetables and fruits, fewer processed foods. Think of it as addition, not subtraction. Add more colorful vegetables to your plate. Add a daily walk. Add more water. The healthy habits will naturally crowd out the unhealthy ones. The DASH diet approach. The DASH diet, dietary approaches to stop hypertension, isn't really a diet. It's a way of eating that emphasizes whole foods, fruits, vegetables, whole grains, lean proteins, low-fat dairy, nuts, and seeds. Studies show this eating pattern can lower blood pressure by 8 to 14 points. That's powerful medicine from food. The focus is on getting plenty of potassium, calcium, magnesium, and fiber while reducing saturated fat and sodium. Here's what a day might look like. Oatmeal with berries and walnuts for breakfast. A large salad with grilled chicken for lunch. Baked salmon with roasted vegetables and brown rice for dinner. Fresh fruit for snacks. Simple, delicious, and incredibly effective. Section 3. Salt reduction strategies. Now, let's talk about sodium, because this is where many people struggle. We're told to cut back on salt, but what does that actually mean in practice? The sodium blood pressure connection. Sodium makes your body hold on to extra fluid. That extra fluid increases the volume of blood in your vessels, which increases pressure. It's like turning up the water pressure in your home. The pipes feel more stress. Most health organizations recommend keeping sodium below 2,300 milligrams per day, and ideally around 1,500 milligrams for those with high blood pressure. But here's the problem. The average American consumes over 3,400 milligrams daily. Where is all this sodium coming from? You might think it's the salt shaker on your table, but you'd be wrong. Over 75% of the sodium we consume comes from processed and restaurant foods. Bread, deli meats, cheese, canned soups, frozen meals, condiments, sauces. These are the real culprits. Practical salt reduction strategies that actually work. First, become a label detective. When shopping, check the nutrition facts for sodium content. Look for products with less than 140 milligrams per serving. Those are considered low sodium. Second, cook at home more often. When you prepare your own meals, you control exactly what goes in. Use fresh or frozen ingredients rather than canned when possible. If you use canned goods, rinse them under water first. This removes about 40% of the sodium. Third, retrain your taste buds. This takes about 2 to 3 weeks, but it's worth it. Your taste buds adapt, and foods you thought were bland will start tasting flavorful again. Meanwhile, foods you used to enjoy will start tasting unpleasantly salty. Fourth, replace salt with flavor. Fresh herbs, garlic, ginger, lemon juice, vinegar, pepper, onions, spices. These add incredible flavor without sodium. I want you to experiment. Try rosemary on roasted chicken. Add fresh basil to tomatoes. Squeeze lemon over fish. You'll discover a whole new world of taste. Fifth, watch out for hidden sodium bombs. Bread can have 200 milligrams per slice. Cottage cheese can pack 400 milligrams in half a cup. Even some breakfast cereals contain shocking amounts. Read labels, and you'll be amazed at what you find. Finally, when eating out, don't be shy. Ask for sauces and dressings on the side. Request that your meal be prepared without added salt. Most restaurants are happy to accommodate, especially when you explain it's for health reasons. Section 4. Stress management for lower blood pressure. Here's something many people don't realize. Chronic stress can raise your blood pressure just as surely as too much salt. When you're stressed, your body releases hormones like cortisol and adrenaline, which temporarily increase blood pressure. The problem is, for many seniors, stress isn't temporary, it's constant. Understanding the stress blood pressure cycle, worry about health, worry about finances, worry about family, loneliness, loss, changes in routine. These create a state of chronic stress that keeps your blood pressure elevated day after day. And here's the vicious cycle. High blood pressure causes worry, which increases stress, which raises blood pressure further. We need to break this cycle. Breathing techniques. Something as simple as breathing can lower your blood pressure in minutes. I'm not exaggerating. There are breathing devices approved by the FDA specifically for lowering blood pressure. But you don't need special equipment. You just need to know how to breathe properly. Try this with me right now. Breathe in slowly through your nose for a count of 4. Hold for 1 second. Breathe out slowly through your mouth for a count of 6. That longer exhale is key. It activates your parasympathetic nervous system, your body's natural relaxation response. Do this for 5 minutes twice a day. Studies show it can lower blood pressure by 5 to 10 points within weeks. Set a reminder on your phone. Make it part of your morning coffee routine and your evening wind down. Meditation and mindfulness. You don't need to become a Buddhist monk or sit cross-legged on the floor. Meditation for blood pressure is simple. Sit comfortably, close your eyes, focus on your breath, and when your mind wanders, which it will, gently bring it back to your breath. Start with just 5 minutes a day. There are excellent free apps like Insight Timer or Calm that guide you through it. Research shows regular meditation can reduce blood pressure by several points, and more importantly, helps you handle daily stress more effectively. Quality sleep. Poor sleep raises blood pressure. It's that simple. When you don't get enough quality sleep, your body stays in a state of stress, your hormones go haywire, and your blood pressure stays elevated. Aim for 7 to 8 hours of sleep each night. Keep your bedroom cool, dark, and quiet. Stick to a regular sleep schedule, yes, even on weekends. Avoid caffeine after 2 p.m. Limit screen time an hour before bed. These small changes made a tremendous difference. Social connection. Loneliness and social isolation raise blood pressure. We're not meant to be alone. Regular social interaction, whether it's with family, friends, a faith community, or hobby group. Serving our needs is one of the greatest benefits of life. The online guide will take you through recovery. Stick to a regular sleep schedule, even on weekends. Avoid caffeine after 2 p.m. Limit screen time an hour before bed. These small changes make a tremendous difference. Social connection, loneliness, and social isolation raise blood pressure. We're not meant to be alone. Regular social interaction, whether it's with family, friends, a faith community, or hobby group. Social connection, loneliness, and social isolation raise blood pressure. We're not meant to be alone. Regular social interaction, whether it's with family, friends, a faith community, or hobby group, provides stress relief and emotional support. If you're feeling isolated, take action. Join a senior center. Volunteer. Take a class. Call an old friend. The health benefits are real and measurable. Limiting alcohol. I know many of you enjoy a glass of wine with dinner, and moderate alcohol consumption may even have some health benefits. But moderate is the key word. For men, that's no more than 2 drinks per day. For women, no more than 1. Beyond that, alcohol raises blood pressure, interferes with blood pressure medications, and adds empty calories that lead to weight gain. If you're drinking more than these amounts, cutting back could drop your blood pressure by 2 to 4 points. Quitting smoking. If you smoke, quitting is the single most important thing you can do for your cardiovascular health. Every cigarette temporarily raises your blood pressure. Long-term smoking damages your blood vessels and dramatically increases your risk of heart attack and stroke. It's never too late to quit. Your blood pressure starts to drop within 20 minutes of your last cigarette. Within a year, your heart disease risk is cut in half. Talk to your doctor about smoking cessation programs and medications that can help. You can do this. Section 5. Monitoring and working with your doctor. Knowledge is power, and when it comes to blood pressure, that means regular monitoring. Home blood pressure monitoring, I strongly recommend getting a home blood pressure monitor. They're affordable, easy to use, and incredibly valuable. Take your readings at the same time each day. Morning and evening are ideal. Keep a log. This information is gold for your doctor. When measuring at home, sit quietly for 5 minutes first. Rest your arm on a table at heart level. Don't talk during the measurement. Take 2 or 3 readings, 1 minute apart, and record the average. Understanding your numbers. Normal, less than 120/80. Elevated, 120 to 129, less than 80. Stage 1 hypertension, 130 to 139, 80 to 89. Stage 2 hypertension, 140 or higher, 90 or higher. If your blood pressure is 180 to 120 or higher, that's a hypertensive crisis. Call 911 immediately. Working as a team with your healthcare provider. Your doctor is your partner in this journey. Be honest about your lifestyle, your challenges, your medication side effects. Bring your blood pressure log to appointments. Ask questions. If you want to try reducing medication as your lifestyle changes take effect, have that conversation. Some people can reduce or even eliminate blood pressure medications with lifestyle changes. Others need medication long-term, and that's okay. The goal is the healthiest you, whatever that takes. So let's bring this all together. High blood pressure is serious, but it's not a life sentence. You have more control than you might think. Move your body regularly. Eat more whole foods and fewer processed ones. Cut back on sodium by cooking at home and reading labels. Manage stress through breathing, meditation, sleep, and connection. Monitor your numbers. Work with your doctor. These aren't complicated steps, but they require commitment. Start with one change, just one. Master it. Then add another. Small steps lead to big results. I've seen it happen hundreds of times. Patients who thought they'd be on medications forever, gradually reducing doses. Numbers dropping from dangerous to healthy. Energy returning. Fear replaced by confidence. You can be one of those success stories. Your future self, the one enjoying grandchildren, traveling, pursuing hobbies, living fully, is counting on the choices you make today. If you found this video helpful, please give it a thumbs up and subscribe to Dr. Carter's Senior Health Guide. Hit that notification bell so you don't miss future videos where I break down complex health topics into practical, actionable advice designed specifically for seniors. Drop a comment below and let me know. What's your biggest challenge when it comes to managing blood pressure? I read every comment, and your questions help me create content that truly serves you. Remember, your health is your wealth. Protect it, nurture it. You deserve to feel your best, no matter your age. This is Dr. Min-Jun Carter, reminding you to take care of yourself because you matter. Until next time, stay healthy, stay strong, and keep moving forward.